Hello, I'm Emma Hammett. I'm the founder of First Aid for Life. I'm a first aid trainer and my business is training people in first aid. We're passionate about first aid and about giving people the confidence and the skills and knowledge to know how to help in an emergency. What I'd like to do now is just go through a few common myths and misconceptions that people very often come along with when they come to the courses. Things like burns. I have heard everything, all different old wives' tales about what you should and shouldn't do and to treat a burn. I've heard onions, I've heard toothpaste, I've heard butter. Please, please do not put any of those things anywhere near a burn. Treating a burn is incredibly simple. If somebody is burnt, what you need to do is get the area under cool running water as quickly as you can. Now, it is slightly more complicated if it is somebody who has had hot coffee spilt on them, because you have a very difficult decision as to whether you are removing the clothes or leaving the clothes on. The big decision is based on the fact that if the skin has had a chance to blister and you remove the clothes, you will remove the skin as well. So it's a difficult decision. If the coffee is piping hot and whoever it is has got very little clothes on, then you would leave the clothes on and run it straight under cool running water for at least 10 minutes. If the coffee is not quite as hot and they've got a few layers on, then you can probably very quickly and very efficiently take those clothes off, ideally with scissors if you can, without damaging the skin underneath. That is your best option if you can, because removing the clothes will mean that you can cool the area more effectively, because the clothes will retain the heat, and treat the burn properly. Now, if you treat a burn properly in the first instance, you can reverse the damage that has been caused. So what you need to do is cool the area, cool it under cool running water. Not too cold if you can avoid it, because that will actually constrict some of the blood vessels and isn't as useful. But cool that burn and keep the person warm, particularly if it is somebody that is elderly or if it is a small child, because it's very easy to go into clinical shock if you're burnt because you're in pain and you're cold, and you will be losing a lot of fluid. So we can cover clinical shock another time, but in terms of treating burns, cool running water for at least 10 minutes. And if the area needs dressing, if you've got a proper burns dressing, then you can dress it and get them to hospital. Always wear sterile gloves. If you haven't got a proper burns dressing, I would recommend you get an ambulance. Keep it under cool running water and get the paramedics to come and assess it. Don't mess with burns. Other misconceptions. What would you do if you chopped your finger off, or if your child's finger got shut in a door and it came off? People very often, their instinct is to, once they've sorted out the child, so apply direct pressure to stop the bleeding and calm them down, they turn their attention to the finger, and the instinct, based on what they see on telly, is to wrap it in the frozen peas. If you do that and you brought it to me in casualty, I'd say I wish you hadn't done that, because the ice right next to the skin will cause ice burns and damage, frostbite. So what you should do, they're nearly right but not quite, is first of all wrap it in a non-fluffy cloth, then put it in some sort of plastic bag or cling film, whatever you've got, and then put it on an ice pack. The important thing is that the ice does not come in direct contact with the skin, because it will damage it. And never wash it, no matter what it has fallen onto, because you're hoping that they can sew it on again with microsurgery. And also, please don't give the person anything to eat or drink, because they will need an operation. So that's looking at fingers being chopped off. What if your tooth gets knocked out? Did you know you could keep it alive in milk or in saliva? because you can, and then it can be reimplanted at a later date. Another common myth is head injuries. I've heard so many times that if somebody has a head injury, you can't let them sleep. What you're worrying about with a head injury is compression. We've all had concussion. When you bang your head, you feel sick, you feel dizzy, you clonk down, you think, oh my goodness, I'm going to die. What happens with compression is that your brain swells. All injuries swell, and concussion is a reversible brain injury. But if it's compression, your brain pushes against other bits of brain and against your spinal cord. And that's why you start seeing signs that something isn't right. And that's what you're looking out for with head injuries. Anything unusual. Compression can happen immediately or up to 48 hours after the bang on the head. So of course you're not going to keep them awake for 48 hours. But what you will need to do is make very, very sure that you've done a full assessment and that they are okay before you let them have a nap, if that's what they need to do. And make very sure that you know the difference between them losing consciousness and feeling sleepy, because there's a big, big difference. Another thing that people get confused about is when you are resuscitating, they expect the person to come back to life. Don't expect them to come back to life, because what you are doing when you are resuscitating is keeping them alive. When you are breathing into them, you are being the lungs. When you are pushing on the chest, you are being the heart. You are being a heart and lung machine. And you need to be pushing down hard enough when you're pushing down on the chest in order to squeeze the heart to do cardiac massage. That's what you're doing. So if you're not pushing down hard enough, then your whole rib cage and the whole structure that you've got will prevent you from pushing down hard enough to squeeze the heart. So what you are doing is being a heart and lung machine, but not expecting them to come back to life. So you're keeping that heart and the brain full of oxygenated blood so that when the paramedics arrive with all their equipment, the defibrillator, the oxygen and the drugs, that they've got a really good chance of bringing them back to life. Choking. Choking is it's a very, very common thing to happen. And it is frightening. And if you can step in and help someone when they're choking in those first few stages, then it makes a big difference. If it is an adult or an older child that's choking, if they are coughing, let them cough. They will cough it up much more effectively than you whacking them on the back. What you want them to do is to cough it up and get rid of it, panic over. If they're not coughing, remind them to cough, even though it's a reflex action. Sometimes getting something stuck can make you think, help, panic. And if you just say, can you cough? Of course I can. Check, are you choking? Yep. In which case, then help them. So if it is an adult or an older child, you would lean them forward, you put the hand on the chest, and you hit them hard. None of this softly, are you all right? It's not that. It's a really good thump, because you want to get it out quickly. And the calmer you are, the calmer they will be. If it's an adult, you would lean them forward. If it's a smaller child, you would put them over your lap so that you can hit them hard. We'll cover babies in a second. So for an adult or toddler, you would lean them over and hit them hard and support them when you're doing it. Up to about 5 times, and check each time you're hitting them. You're treating them like a giant tomato ketchup bottle. When you are hitting them on the back, you are using the air and the force behind the air to force that obstruction out. So they won't be able to speak to tell you that it's come out, and you won't have any idea unless you check each time. And otherwise you'll find you're going wham, 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 and it's come out on one, and you're still hitting for good measure. So you are looking to see if they've been sick on the floor. If they start to cry, then they're not choking in a life-threatening manner anymore. The obstruction might still be there, but it's no longer blocking their airway completely. So you do up to 5 back slaps, and then your second line treatment for choking on an adult or older child would be the old Hammett maneuver. So what you would do is make a fist like that, put it between your tummy button and under your rib cage. You would lean forward and you pull up and under hard. And it should come straight out like Mrs. Doubtfire. Abdominal thrust, it's called, Hammett maneuver, whatever you want to call it. It can do damage. So if you are doing this, you need to make sure that they are checked over by a medic afterwards to make sure you haven't done any harm. And you always do this second line, not like on telly when they go straight in and do that. You're going to be doing the back slaps first because it doesn't cause any harm. And that's the important bit. The whole point of first aid is to promote recovery without making anything worse. Okay, so if it was an adult or an older child that was choking, you do 5 back slaps, 5 of those, 5 back slaps, 5 of those, 5 back slaps, 5 of those. Get an ambulance on the way. It's not looking that great. It should have come out on those first 5 back slaps. If you're hitting hard enough and calmly enough, most of the time, it will come out. If it doesn't come out, they will start to lose consciousness. And we'll cover that in a second. Right, for a baby, slightly different. You need to obviously support them much better. So for a baby, you would put your finger and thumb on their bottom jaw, support under there, holding the airway open, which for a baby is horizontal to have the airway open. And then you would roll them over and put them down your leg like that so that they are supported completely. And then you would hit them hard. You've obviously had a look first of all to see if there's an obstruction in there, and you would look like that rather than like that because you want to let gravity help. Lean them down like that and hit them hard and check and check up to about 5 times. Again, you're looking each time to see if they've changed colour, if they're crying, if the obstructions come out. Well done, you've sorted it. If it doesn't come out on those first 5 back slaps, your second line treatment for a baby is never the Hammett maneuver. You will do serious damage with a baby if you do that. So for a baby under a year, your second line treatment between the nipples, centre of the chest, and you would be pushing upward thrust like that, and the obstruction should come out. So you do 5 of those. 5 of those, 5 back slaps, 5 of those, 5 back slaps. Get an ambulance on the way. If it doesn't come out, they're going to start to lose consciousness. When you lose consciousness, everything relaxes. So whatever's holding it could start to loosen and it might come out. I would give them one more quick whack. If it doesn't come out, you're now having to resuscitate. Okay, and you would start by giving breaths and then compressions, pushing down hard enough and breathing in properly. Okay, thank you very much, and I hope that's been helpful.